exploring the devastating impact of major historical pandemics on humanity. Pandemics have been pivotal in shaping human history, often acting as catalysts for sweeping changes in population, economy, and culture. Their impact is profound, influencing everything from demographic shifts to societal structures and global interactions. The Antonine Plague ravaged the Roman Empire, significantly weakening its military and economic stature. This devastating event contributed to the empire's gradual decline, highlighting the vulnerability of even the most formidable ancient powers. The Justinian Plague was another catastrophic illness that decimated the population of the Byzantine Empire. It disrupted agricultural production and weakened the empire's defenses, setting the stage for prolonged periods of turmoil and decline. The Black Death transformed European society irreversibly. It reduced the population drastically, which led to significant economic and social shifts, including the end of feudalism and the rise of a more market-based economy. The Cocolitli epidemic was particularly lethal to the indigenous populations of Mexico, leading to a drastic reduction in their numbers. The epidemic accelerated the cultural and demographic shifts under Spanish colonial rule, altering the region's historical trajectory. The 16th century witnessed devastating American plagues, notably smallpox, which ravaged Native American communities. These diseases, brought by European explorers and colonizers, led to massive population declines and disrupted indigenous societies across the continent. In 1665, the Great Plague of London struck, highlighting the vulnerability of urban centers to disease outbreaks. The epidemic prompted the implementation of early public health measures, such as quarantines and the culling of animals believed to spread the disease. The first cholera pandemic in the early 19th century demonstrated how rapidly disease could spread along trade routes, affecting populations on a global scale. Cholera traveled from the Ganges Delta in India to far-reaching areas, carried by the movement of ships and goods. By its third sweep from 1852 to 1860, cholera had claimed the title of the deadliest outbreak, underlining the dire need for proper sanitation and public health strategies. This pandemic spurred advancements in water supply and waste management systems. The Russian flu in 1889 marked the first significant influenza pandemic of the modern age, spreading rapidly across continents via the newly robust networks of global trade and transportation. It underscored the growing interconnectedness of the world and its impact on disease transmission. The Spanish flu of 1918 to 1920 stands as one of history's deadliest pandemics, claiming up to 50 million lives worldwide. This influenza outbreak disrupted societies on a massive scale, overwhelming healthcare systems and causing widespread panic. By 1957, the Asian flu emerged, propelled by H2N2 strains. Scientists scrambled to understand and mitigate the virus's impacts as it mutated. This pandemic highlighted the urgent need for rapid development and distribution of vaccines. The Hong Kong flu in 1968 further tested global health systems, causing significant economic strain. Improved public health strategies and advancements in medical technology played crucial roles in managing the outbreak and reducing fatalities. The HIV/AIDS pandemic, identified in 1981, continues to affect millions. Despite significant medical progress and increased awareness, it remains a major public health issue, emphasizing the need for sustained international cooperation and research funding. In 2009, the H1N1 swine flu pandemic spread quickly across the globe, catching many by surprise. However, swift international collaboration led to the rapid development and distribution of vaccines, showcasing the power of preparedness and global unity. The West African Ebola epidemic exposed severe inadequacies in health systems across affected regions. International aid and emergency responses were crucial, yet the delayed action highlighted the need for more robust healthcare infrastructures. The Zika virus outbreak uniquely impacted neonatal health, with thousands of babies born with microcephaly. It underscored the importance of rapid health advisories and international cooperation in managing mosquito-borne diseases. COVID-19 brought the world to a standstill with widespread lockdowns, affecting economies and daily lives. This pandemic highlighted the critical need for timely global coordination and responsive healthcare systems to manage such crises. The mental health crisis emerged as a significant secondary impact of pandemics, with isolation and anxiety becoming as pervasive as the viruses themselves. Addressing mental health has become essential in comprehensive pandemic response strategies. Long-term economic effects of pandemics often reshape labor markets and global trade. The disruption to supply chains and shifts in employment demand prompt a reevaluation of economic dependencies and resilience strategies. Cultural responses to pandemics have been profoundly influential, often reflecting societal anxieties and hopes. Art, literature, and media not only capture the zeitgeist but also offer solace and understanding, helping communities process trauma and envision new futures. Public health systems have evolved dramatically due to the pressures of pandemics. These crises have spurred enhancements in surveillance, response strategies, and community health policies, ultimately strengthening public health infrastructure and preparedness for future outbreaks. Technological innovations have emerged rapidly as a response to the urgent needs presented by pandemics. From advancements in telemedicine to the development of contact tracing apps, technology has been pivotal in managing disease spread and enhancing communication. Political landscapes often shift significantly in the aftermath of pandemics. Governments face increased scrutiny regarding their responses, and policy adjustments frequently occur, aiming to improve resilience and readiness. Sometimes, these events even catalyze changes in leadership or political ideology. The spread of misinformation during modern pandemics, amplified by social media, poses significant challenges. False information can spread as quickly as the virus itself, leading to public confusion and mistrust, which complicates efforts to manage health crises effectively. Pandemic preparedness has become a critical focus following recent global health crises. Nations worldwide are analyzing past outbreaks to develop robust policies that ensure quicker responses and more effective containment measures for future pandemics. The ecological and environmental impacts of pandemics are profound, often altering ecosystems and biodiversity. As human activity slows during lockdowns, some regions have seen a temporary rebound in wildlife populations, highlighting the intricate link between human health and biodiversity. From a sociological viewpoint, pandemics exacerbate existing social inequalities. Vulnerable populations typically suffer the most, lacking access to healthcare, facing economic hardships, and enduring higher rates of disease and mortality. This underscores the need for equitable healthcare solutions. Globalization plays a dual role in pandemics. While it facilitates the rapid spread of diseases via international travel and trade, it also enables swift global cooperation in response efforts, exemplified by the sharing of information and resources. Looking forward, the ability to predict and prevent the next global pandemic hinges on enhanced monitoring systems, international cooperation, and ongoing research into virus behavior and mutation. Proactive measures are essential to mitigate future health crises.